Welcome to Complicating the Narrative. I'm your host, Salma Abdallah, an assistant professor at Washington University School of Public Health. In recent years, public health, and especially epidemiology, has been at the forefront of global conversations. Everyone has become, in some way, an armchair epidemiologist. But with this newfound attention, we've also seen how easily epidemiological evidence can be oversimplified, leading to polarizing views and sometimes impractical solutions. These dynamics reflect the methodological realities of the field itself. Consider the inherent challenges. Epidemiological research is predominantly observational, and sometimes researchers try to infer causation from data where experimental control is impossible. Studies can also involve measurement error, selection error, and unmeasured confounding, among other challenges. The critical question is not whether these limitations exist, they do, but how systematically and transparently we account for them in our analyses. Today, we're going to dive into the very heart of the matter and ask, how can we make epidemiology better? How can we push the field to be more rigorous, more transparent, and more prepared to tackle the complex and messy realities of our world? Our guest today has dedicated his career to advancing both epidemiological methods and critical reflection of the discipline itself. Matt Fox is a professor of epidemiology and global health at Boston University, where his work spans infectious disease epidemiology and critical examination of methods. Professor Fox is a co-author of the textbooks Quantitative Bias Analysis, providing epidemiologists with approaches to characterizing and adjusting for systematic errors in observational research. He also hosts two podcasts, Free Association, which critically examines the current public health literature, and Serious Epi, which reflects on the epidemiological methods of the field. Through these platforms, he fosters ongoing dialogue about improving our scholarship. I have argued, debated, and learned from Matt for years. I believe that what distinguishes his approach is its constructive foundation. His methodological critiques emerge from a fundamental commitment to strengthening epidemiology's capacity to generate reliable evidence. His writing often addresses how the discipline can maintain scientific rigor while tackling increasingly complex and messy population health challenges. Matt, welcome to the podcast.
Glad to be here.
So maybe I just wanted to start first with asking you about why you wanted to be an epidemiologist in the first place, maybe walking us through your career, but also why did you think within epidemiology you should focus on the methods and how do we improve our methods when it comes to this field of mostly observational research?
Yeah, so this is going to be a bit of a disappointing story in that I don't know that I ever sat down and said, "Oh, I want to be an epidemiologist." I just kind of stumbled into it. So as you know about me, I was a literature major as an undergrad. I had no interest in science or anything quantitative at all, but I always had a knack for it. I just didn't enjoy it as much. And so after, with no marketable skills whatsoever, I went into the Peace Corps after I finished my undergrad, and I spent a couple of years in Turkmenistan. And there I saw, a lot of issues that I thought I didn't have the words for at the time, but that I thought public health could really address, but I didn't really know what public health was. So when I came back, I did, some odd jobs for a bit, but then got a job here at the School of Public Health. No idea what public health even was thinking I wanted to do something maybe more kind of economics focused, and was doing this job. And they said, well, economics, development and health are very intertwined. You might want to think about just doing an MPH, a master's in public health. So I did that with a plan to do global health. And I did all of the credits for the global health uh, major concentration, but I didn't want to write the final paper that you had to write because I also I also realized at the time that I was interested in epidemiology. It just sort of kind of spoke to me in a way. And what I liked about it was it gave me tools to be able to answer questions about the way that the world works, the causal relationships between things that I think we're gonna talk about in ways that just I never thought about before. I mean, it sort of speaks a little bit to my interest, poorly researched, but sort of an interest in sort of the philosophical side of understanding the way the universe works, and also the practical side. How do we actually do things that are, or do research that is actually going to impact the health of populations? And so, no real plan, just kind of stumbled into it.
And he kept stumbling into making it more of a focus to improve the field itself. That's interesting.
Right. So you asked about how did I sort of get to the methods side of it, which
Yeah.
is, I had my mentor in my early days of my PhD program was Tim Lash. Tim is a cancer researcher, but he also has a strong interest in methods. And I took his class and just started to realize there were all these kind of really fascinating aspects of how we do epidemiologic research that people understood the general ideas of, but they didn't understand the nuance in a way that they had written it down and could convey it, which meant you had to kind of learn everything on your own. Not the big concepts; those were all there, but sort of the nuance. And I got interested in that, and that also led me to a realization that, okay, and I do want to make this clear up front. I am critical of the field of epidemiology, but I do that because I believe it's really important, and I do believe that on average, epidemiology is more likely to get it right than to get it wrong. But when we get it wrong, it has serious consequences, and therefore, I think I really want to push the field to be better. So my interest in methods really came about from that, just a desire to see us get better at being able to do cause and effect research in a world where it's hard to do.
I guess then this brings me to my first question, and my hope is that more people are listening that who are not epidemiologists as well. If someone is not an epidemiologist, in the simplest terms, what is epidemiology, and what would you say epidemiology does best when it's operating with the best methods that we have?
Hmm. So epidemiology is the what we think of as the research methods of public health, along with biostatistics. But you could also add in a lot of other fields within that. But sort of historically, epidemiology and biostatistics were kind of seen as the research methods of public health.
Or at
And
least
it's
epidemiologists feel that they are the foundation of public health. Yeah.
Well, to be and fair, and I do think we sort of branded ourselves that way, and
Yeah.
you could absolutely put a lot of other research methods in that category. But historically,
Yeah.
that's where things kind of got started, and therefore that's where people tend to think of it. And epidemiology does a number. I mean, I could give you the definition, but I don't think that's going to help anyone. We study the distribution and determinants of diseases in populations, but what we really do is we try to describe patterns of disease. We try to predict where disease is going to occur and who it's going to occur in. And then we try to understand the causes of disease so that hopefully we can find ways to intervene on those causes, or at least identify who's likely to develop a disease so that we can apply other interventions. And then
And
you
the
asked me another question, and I don't remember what it was.
That's fine. I'm used to that.
Yeah, good.
Yeah. So for the past few years, and you and I think we spoke about this a lot. Epidemiology has been front and center. It is
Yeah.
very hard to not open, at least during the early years of COVID, not to open up your TV and hear the word. We're talking to an epidemiologist today about X, Y, Z. How do you think that this visibility actually impacted the field, especially also taking into consideration that it wasn't just visibility in popular media, but it was also visibility in social media, where epidemiologists had to interact with people from other disciplines as well as lay people who wanted more information. And do you think that visibility also impacted your own work?
Oh yeah. The answer to the last question is definitely yes.
Yeah.
So I think that visibility was very problematic. So I think that the field of epidemiology has always kind of I think we've seen ourselves as a little bit undervalued, in the sense that which isn't to say that medical research and public health research isn't valued, but I think the old joke is that an epidemiologist goes to a party and people say, "What do you do?" You say, "I'm an epidemiologist," and they say, "Oh, you're a skin doctor."
Yeah.
And people didn't know what it is we did, and what our contributions were to improving the state of the world. COVID came along and suddenly everybody was paying attention to epidemiologists. And I think we were not prepared for that. Like we thought it would be good for us to have more visibility, but I don't think what we didn't anticipate was there is, to be fair, there's a good amount of epidemiology that is gets published that isn't great. And, I think as epidemiologists, we are pretty good at separating the very good from the very bad. Then there's a whole bunch of stuff that's in between that we kind of spend a lot of time debating whether it's good or it's bad. And, that has always been done kind of outside of the public's eye. When COVID came along, there was both an incentive to produce a lot of research very fast, which necessarily means that a good amount of it isn't going to be great research. But also the public was paying a lot of attention, and that meant that anybody who had any kind of desire for the research to come out a certain way could always find evidence to support their particular political or philosophical or personal leanings. And we as a field, we're not prepared for that. We do science. We're not prepared. We're not taught how to do communication. We're not taught how to deal with social media. We're not taught how to deal with incentives that are different from ours in terms of how the results come out. And we could talk about what our incentives are, which aren't always aligned with the best research. But certainly when it came to the public just diving in and devouring all this research that was coming out in COVID, it's challenging. And I think I have I listened to a number of podcasts where you hear people say, you know I do my, I'm going to do my own research. And, there's pushback to that. And then they say, no, that's, exactly what you should be doing. Well, it's actually not that easy to
Hmm.
look at a study and understand whether or not it's a good study or a bad study. So you do unfortunately have to rely on people with some expertise in that. Now, I think you can make arguments about whether or not we've done a good job at democratizing that and whether there's been some gatekeeping that hasn't been helpful. But in general, I think you do need, somebody with expertise to interpret it.
How do you account then when we're thinking about people of expertise? I don't know, maybe I'll consider both you and I people who are experts. How do we account for our own incentives or ideological leanings when we interpret the results that we're getting in our research? Again, you and I spoke about this a lot.
You and I have been speaking about this for years and years. I think it's challenging. So, one of the things I talk to my students about a lot is the fact that if you're reading a paper, you're reading in my personal view, you should always ask yourself before you read that paper, what do you think about this hypothesis? Because, if people come up with very, absurd hypotheses, things that are, like, I don't know, that I can move things with my mind. Claims like that require extraordinary evidence. And so just because one study or extrasensory perception, just because one study comes along and says, hey, I've proven that people can do it, well, my bar was pretty high against it to begin with. The other thing that I tell them is, okay, so you also want to look at who's funding this research, because if I know that a drug company is funding a particular study, then I'm going to set my bar a little bit higher before I accept their results. Not, which isn't to say that, lots of good research gets funded by drug companies. They often, contract with outside groups to do the work. But, you know, anytime anyone's giving you money, you have some incentive to want things to turn out the way that will be best for them. And so I don't, it's not that I think that anyone's doing anything inappropriate. It's just there are subtle ways that things can influence, the way the decisions that we make in our research. And so I always say, set your bar a little higher. But the more difficult thing to do is to recognize our own incentives, because we as academics think, well, I don't have any profit to be gained from the way that my research turns out. And so I'm a neutral arbiter and I'm just doing research. But as you point out, we all have our own political views on things. We also just have our reputational views, right? If I have a particular philosophy, a particular hypothesis about the world, I have a slight incentive to want the research that I do to turn out and confirm my prior beliefs. And so I think it's really important that we acknowledge that up front and recognize we have our own incentives. There are actually financial incentives for us. They're
Yeah.
not profit based. I'm not making money off of my research, but my salary and my promotion and my ability to get grants to do the research is tied to me doing research that is high enough profile that people pay attention to it. So there are these incentives, and I think we have to recognize that we have incentives too. I also think we have to be careful though, because that gets weaponized against us.
Hmm.
The minute you acknowledge that you too have incentives and biases, people will take that and say, therefore, I can dismiss anything that you produce that I don't like, rather than actually looking at the research itself
Hmm.
and finding, reasons to either like or dislike it. So it's a difficult situation we're in.
Yeah, it just reminds me of I guess at the extreme recently, all the news we're hearing about the Alzheimer's disease and how the financial incentives clearly were part of why some research had just continued following one hypothesis. I do agree with you. I think from what you said, I think the personal incentive itself, just to sit with yourself and say, am I hoping for a certain result to come out true or not? That might be helpful. And but also, as you said, it is very hard to then balance saying that to yourself, making it clear in your own thinking and your own writing. But then what happens when people take that to the world, especially in a world of social media where someone says, see, Matt just said on a podcast that he does have his own incentives and political leanings, and what do we do with that?
But Sally, you're the host of this podcast, but you are also a researcher, right? So
Yeah.
you also have your own leanings and
Yes.
incentives. So how do you think about this, and how do you make it transparent? You can tell I also host podcasts because
Yes.
I'm turning this on you.
Exactly. Once a host, always a host.
Absolutely.
Yes.
I'm
Um,
struggling to wrest control back from you.
Yeah, I know. It's very hard, Matt. I'm sorry. No, but I agree with you. I really struggle with this increasingly, and I think I like one of your experiments that you asked us to do in class. How much would you wager on one of your studies being? I don't know if you want to explain that more
Y-
to
Yeah,
people.
let
Yeah,
me just
yeah,
explain it. So one of the questions I've been asking students for years is, just imagine that we lived in a world where you had to bet, effectively risk $1,000 of your own money every time you published a study, that within 10 years you'd be proven right. And it gets absurd immediately because there's no way to prove something was
yeah.
right or wrong. But let's just say we had a way. And if you turned out to be correct, you'd get $10,000 back. But if you were wrong, you'd lose the $1,000.
Mm.
The question is, and it had to be your own money, it's not grant money or anything like that. How many fewer studies do you think you would publish, even if you recognize the fact that you would only have to be right 1 in 10 times to break even? I think people then immediately recognize that there are some studies that we publish that we're not so sure about. We're not as confident as we portray in our discussions of our findings, because again, the incentives are aligned for us to, even if things go right, we're always incentivized to play up the importance of our work and the implications of our work, again, to get the next grant, to get the promotion. So I think I would imagine far fewer studies would be published. What do you think?
I think far fewer studies would be published, and I think we discussed this in your class. So, just for the listeners, I sat in on Matt's advanced course, EP course, just because I really wanted to hear how School of Public Health trainees in or doctoral trainees in epidemiology get introduced to the complexities of the methods that we use. And I think my question to you, which I really struggled with this question because on one end, I would love people to have more confidence in the type of data they're publishing. On the other end, I do think of science as a practice, just accumulates or as knowledge accumulates over time. So I don't know if I prefer more wrong research being put out there and maybe if it's 20% of the research is correct compared to 80%, and it just accumulates over time and it'll find a way. And maybe this is blind trust in the process of knowledge generation versus saying, no, you can only publish things that you're confident about because maybe I don't even trust myself. I know what I don't know. And what are the things I trust? Maybe I'm not the thing things that would advance the knowledge generation process.
Yep.
So I guess maybe it is helpful if we're thinking about, do I trust the methods I used versus do I trust the research question I asked? And maybe then um, something went wrong in the process and I got the results that I don't trust. And if I have to wage or have to bet $1,000, if I get a result that doesn't make sense to me, maybe I think that maybe I shouldn't publish it. And that could be a helpful result that should have come out. So it's really tricky for me. Just to answer your earlier question, I don't know if I have an answer for that. I think one thing I try to talk to my students about, but also try to look into in every paper I publish, is to think there are three things I should think about all the time: the scientific approach to what I'm doing, the values that I hold, and also the real life trade offs. If the science is valid, hopefully most of the time, then I always try to think, are my values really shaping how I describe the results of this scientific paper? So that when it comes to the discussion section, what am I choosing to emphasize versus not? And the trade off is really at the end, the last part, which I think I know you're not a fan of, is what do I, at the end, prescribe as the best way possible. So just I also keep in mind that for me, saying people need to be healthy all the time is probably not the same trade-off that someone else would have who has different values from me. I'm not sure if it helps, but that's at least one thing I started thinking about
Mm,
after the COVID-19 pandemic and how I write a paper.
yeah. So one other thing to note about that sort of question that I pose is it sets up another discussion, which is what does it mean to be right or
Yeah,
wrong when in your research? Um, we, that whole right or wrong is in some ways a very unhelpful binary, because there is, it breaks it up into I did something, I got, I found the answer or I didn't. But our job isn't as epidemiologists isn't to say, oh, does smoking cause lung cancer? Our job is to say, does smoking cause lung cancer? And if it does, how much
yeah,
does smoking increase your risk? Well, so I could get the answer to the question, does smoking cause lung cancer, right? But I could get the magnitude wrong. And that would be, in some ways, very harmful to how we then go about dealing with the problem. Because if smoking turned out to increase your risk for lung cancer and everything else that it's pretty bad for, but the increase in risk was small, then we might say, okay, well, it's a problem, but it's not going to be our number one problem, and we're going to focus on other things. But it turns out, heavy smoking is associated with really, really strongly increased risk for lung cancer and cardiovascular disease and all these other things. If I underestimate that, I then do a disservice, because we might say, we're not really going to worry about it as much as we would if we knew the true answer. So it isn't really a binary. It's not a yes no. It's a how much. And we can get the correct answer to the dichotomy, but the wrong answer to the magnitude,
yeah,
and end up in the same problematic space.
yeah.
And that's where we start to think about uncertainty. How do we actually describe uncertainty?
So this brings me up. I think I usually like going through the list of my questions, but this maybe brings up something I was going to talk about later. I think it's a very, very good fit here. A recent paper that you published on the evolution of the Bradford Hill criteria, because I do think it made a really important distinction, and it would be helpful to talk through that with our listeners. So you talked about moving from hazard identification to risk assessment approach.
Mm-hmm.
And I did think that was a really helpful way for me to think about it. And I do a lot of descriptive epidemiology work, thinking about the type of research I want to do and also the type of publications that are worth it to put out there in the world versus not. So maybe talk a bit more about that paper, and we'll put it in the show notes as well.
Yeah. So for listeners who are not familiar with this, some of the one of the biggest questions that we have to ask ourselves in epidemiology when we're doing research is how do we know if we're doing causal research? How do we know if we've gotten there? Because there's no truth that we can look to and say, oh, compare what I got to the truth. We're always sort of trying to figure out whether or not we got to the right answer. And Sir Austin Bradford Hill was one of the folks working in the early days of what I think of as sort of early chronic disease epidemiology, working on smoking and lung cancer. And he put together this list of factors that he said they can't tell you whether or not you have reached causation, but there are things to think about. And there are things like, the strength of the effect. So if, the smoking and lung cancer example, he said, the effect of heavy smoking on lung cancer is massive. It's like, you know, for a heavy smoker, you're 30 times more likely to develop lung cancer than somebody who didn't. Well, one of the problems that we deal with in observational epidemiology, meaning cases where we can't actually do an experiment and tell people you smoke and you don't, because it would be unethical or impractical. Well, we have to deal with this confounding problem. Confounding is the idea that, there might be some other explanation that just got caught up with your exposure of interest, in this case, smoking, that actually is the real culprit. And you just didn't know about that other factor or didn't adjust for it. And so it looks like smoking is the problem when it isn't. And in fact, in the early days of smoking and lung cancer, there was this sort of genetic hypothesis that was proposed. There was this thing that would make you, more likely to want to smoke and also more likely to develop lung cancer. It's not true, but it was just kind of thrown out there. And so he said, well, look, if the effect is really large, it's unlikely there would be some other factor that we don't know about that also just has this very large effect on lung cancer that would completely explain away the effect. He had a bunch of other things that he talked about, but strength is the one that you were sort of getting at. And our point in the paper, sort of rethinking it, was just to focus on this idea, and it's not novel to us or new in any way, but just this idea that as I said earlier, it isn't our goal in epidemiology to determine cause and effect.
Hmm.
It's to determine the strength of the effect.
Have you said that to some of the causal inference people in
I,
their face?
we, the question, it's a good question. I don't know if I've ever said it to them, but I think they would agree with it.
Okay.
I mean,
Okay.
causal inference is about not determining a yes no, it's about determining the magnitude of the effect. I get the sense you disagree with that.
I think ultimately, yes. I don't know if the same language would be used, but I agree with you. I think essentially maybe people agree it's about the magnitude, but how it's being framed is usually about we're finding that one, like the specific cause, the yes or no question, at least in the general framing. I could be wrong. Causal inference people, please, if you email me, say nice things, but I could be wrong.
Yeah, no, that's an interesting distinction because I could see why it would come across that way, but my experience has not been that folks in the causal inference space are really focused on dichotomies as much as it might appear. I mean, causal inference kind of sounds like a binary,
Yeah.
as opposed to if they'd called it, causal effect size estimation.
Yeah.
But that's a mouthful, and so
Yeah.
they've got something a bit more
Cashier. Yeah.
compact.
Yeah.
Um, but I but again, I do think so. I do think that strength of effect is what matters. And I always say that the example of if you tell me that eating ice cream causes cancer, there's very little I can do with that because I would have to balance the idea that eating ice cream causes cancer with the idea that I just really like
Screen.
ice cream, especially if
Yeah.
it's Ben and Jerry's fish food. And
I mean,
so
in a way, existing causes cancer, right?
I guess that could be true.
Yeah.
But in order for that to be true, you would have to compare existing to not existing.
Do
Uh,
you think that's just not an experiment we can do?
I mean, you could try it, but I don't think you get that through an IRB.
Okay.
But that's up to you.
Yeah.
Um, and so so I can't make any good decisions unless you tell me how much. Because if you tell me my baseline 10-year risk of developing cancer is 0.5%. And if I eat the ice cream over the next 10 years, it's going to go up to zero point 0.7 of a percent, then I'm still going to eat the ice cream because it's still going to increase my risk, but I'm going to balance that with how much I enjoy Ben and Jerry's fish food, which is the best flavor of ice cream.
We can agree to disagree on that.
Oh boy.
So then, maybe just stepping back and thinking about not just the estimate itself, but how we ask the question to get to the estimate. In 2019, I think you wrote a really good paper. Again, it's very hard for me to give a lot of compliments to Matt over the
I'm
course of
sorry
time.
that you're forced to do this.
So I'm doing this a lot today, but I do think it's a really helpful paper for anyone who's teaching epidemiology, thinking about how can we train doctoral students? How can we train ourselves to ask research questions? Because from there, a lot of the results that we get could actually be helpful or not. What do you think is maybe limited in the way we frame research questions in epidemiology, and what can we do to improve how we ask questions?
Yeah, so there's a lot to unpack there because there are different aspects of asking good questions that matter. So you had Dean Sandro Galea on your first episode of the podcast. He's somebody who's been highly influential in our field, and he talks about the idea of asking consequentialist questions,
Yeah.
meaning, you know, you can think about science as just a pursuit for the quest for knowledge, and so you might say, I don't really care whether any question that I ask is of importance to anyone. I'm just curious and I want to know the answer. And that would be fine if we lived in a world of infinite time and resources. um, but the reality is, most of the research that we do is funded by grants. In our case, funding from the United States government, which comes from taxpayers. So you can make a really strong argument that I have an obligation to not just do research that is of interest to me, but research that will actually lead to improvements in the health of populations. They should therefore be important questions. And we don't necessarily train people in how to think about what are the most important questions. And part of the reason we don't do that is because you can argue again that I have an obligation to the taxpayers to focus on the things that are most important. But the funding agencies themselves set the priorities for what will
Yeah.
get funded, and those aren't always aligned with the things that are the biggest problems. So we often have to teach students about how to understand where the money is to be able to do the research, and then help them figure out, okay, within that, how do you ask questions that are still really important.
Hmm.
But you can make an argument that we actually have to improve the process by which we allocate funds. So that's one aspect, the importance. The part that I focus a bit more on is, how do we actually say, okay, once I know the general area that I want to do the research on, how do I actually ask a question that can be answered with data? And part of the problem with that is, we don't really teach people how to ask questions that actually correspond to anything that we could ever do to improve health in the real world. And the reason for that is, at least I think the reason for that is, the field of epidemiology, along with every other quantitative field, has gone through a process by which computing power has advanced dramatically in the 25 years that I've been doing this.
Yeah.
Access to large data has become is just increased dramatically, and we teach students how to run computer models, regression models, to pull out information from that data. And the challenge becomes, if you start with a model and don't start with a question, you
Hmm.
can get information out of a model that does not actually correspond to any interesting or useful question. But it came out of a model, came out of a lot of data. It seems like it should correspond to something important. And therefore, we then backfit a question, and often we get that question wrong. And so
Hmm.
there's been a movement within the field to really push people to make sure they're starting with questions and then finding data to answer that question, not starting with data and then trying to retrofit it to a good question.
Can you think of an example, maybe for those who are not familiar or who are not epidemiologists, of having the wrong framing leading to maybe misleading conclusions in
Yeah,
epidemiology?
so the you'll remember this example that I use in class. I do it
Yeah.
on the first week of class, where I say, okay, there is this condition. It's called myeliomeningocele. It's a form of spina bifida,
Yeah.
meaning that these uh, uh, fetuses in utero, the neural tube doesn't actually close all the way,
Hmm.
and so it's a really severe condition. And you have a child who's born with this condition, you're going to have to immediately do surgery to close the neural tube. And so I say, okay, so imagine, and this is based on real, real situations. People develop a surgery to do that, where they can go in and actually close the neural tube in utero. So before the baby's actually born, you do a surgery, you close up that neural tube. But we didn't run a randomized trial. It was just, some people in a hospital decided that they were going to try to pioneer this technique. So all we have is a group of kids who got the surgery and a group of kids who didn't get the surgery. And there's all kinds of reasons why those might be, populations that are very different. But let's pretend that they were sort of very comparable, that we just sort of chose people at random. And then I say to my students, okay, design for me a study that evaluates whether the in utero surgery is better than or the same as or worse than the waiting until the child is born and doing the surgery. Design me an observational study and specifically tell me, when are you going to start following all the kids?
Yeah.
And inevitably, what they come up with is some version of, we're going to take kids who got the surgery in utero, we're going to start their follow up at the time of surgery, and then we're going to take the kids who got surgery postnatally, and we're going to start follow up for them when they get the surgery, and then we follow them in for say 5 years, and we'll see which group has better survival. And then the challenge becomes, what do you do with kids, with fetuses who never made it to birth? They
Yeah.
passed away in utero, um, and so they never had the prenatal surgery, but they never got the chance to get the postnatal surgery. And inevitably, students say, okay, we exclude them because they're not in our study question, which is prenatal or postnatal.
Yeah.
And that's when you realize there is no world where a doctor is ever confronted with the question of prenatal surgery versus postnatal surgery, because you can do prenatal surgery, but the comparison is not then to do postnatal surgery. The comparison is then to wait
Yeah.
and do postnatal surgery if the child survives. But
Survivors. Yeah.
children can die in between, and those deaths are actually part of the consequence of waiting. So the question that's actually presented to a surgeon or a doctor is a question of surgery now versus wait and do a surgery later. It's not do the surgery later.
Yeah.
But that's not the question we ask with data. We ask a question that is surgery now versus surgery later. And even if you could get a reasonably, unconfounded estimate, it doesn't correspond to anything we could ever do in the real world. And therefore, it doesn't help anybody.
Hmm. So then let's imagine we are not faced with this specific problem. We found a way to ask a research question. We have an excellent data set that corresponds to something happening in the real world. What are the tenets or the methods that should we use to make sure that we actually get a really good methodological approach to that research question, which is this is what you teach in the advanced epi course. So what is the process should I go through as someone who's designing that data analysis?
Yeah, so there's no one answer to this question. That we have lots of different study designs, we have lots of different analytic approaches, we have lots of different ways that we can design studies to minimize the types of biases you referenced in the beginning: selection bias, confounding, and measurement error. But the key is to think through all of those different issues, and be honest and transparent about what we can and cannot do. So I always say to my students, all research studies are an exercise in the rational use of limited resources. We
Hmm.
only have so much time and we only have so much money. So we can never do the perfect study. And I should make it clear, even randomized trials, we can never do the perfect randomized trial either, because we deal with humans. They can drop out of our study. We can measure things wrong. So even trials have problems. The goal is to identify any places where things can go wrong, do everything we can to minimize the impact of those, and then to be honest and transparent and quantify the impact of anywhere where we know things did go wrong. And there's been a movement in the field of epidemiology more recently towards what's called a target trial approach.
Hmm.
The target trial approach says, okay, we do lots of studies in which we cannot do a trial. There ethically you couldn't do it, practically you couldn't do it, whatever the reason is. That's okay, but let's design our observational studies the way we would design a randomized trial, and then we'll make that observational study mimic the trial as best we can, and then we'll recognize anywhere where it goes wrong. And I say that because if you think back to the example we just went through with myeliomeningocele, you would never design a randomized trial that started some kids at in utero and some kids at birth. You always have to have a time at which you randomize them. And follow up then starts immediately after you randomize them. So you could get out of the problem of misidentifying when to start the follow up in that study if you first said, okay, what is the ideal trial I would do if I could? You're never going to be able to mimic it perfectly because it is observational data. But at least then you're aware of the problems, you minimize as many of them as you can, and then you quantify the impacts through a set of methods that we can talk about if you want, where we can actually be more transparent and we can get estimates that that are account for those things that go wrong, but that also acknowledge the additional uncertainty that comes from the fact that we didn't do the perfect study.
Do you think pre-registering our analysis methods is a helpful approach?
Yes and no. So
Okay.
I do in general,
Mhm.
and so I don't know how familiar with your audience would be with the idea of pre-registration,
I
but
think you
the
should
idea,
explain.
what's that?
You should definitely
Yeah.
explain.
So pre-registration, the idea is when you do a randomized trial, you if you want to get that study published in any journal, they require you to register it ahead of time, which means you have to go onto a website. You have to tell them how you're designing your study, how you're going to intervene, how you're going to randomize people, how long you're going to follow them, what is the hypothesis you're testing, and then what are the outcomes that you're going to use to determine whether or not your study was a success. And the reason that you do that is, historically, before we had registration, imagine I want to do a study of some new drug, and I'm going to compare it to, some alternative drug. And what I'll do is I'm going to collect data on 100 different outcomes. And then I then do my study and I find that actually the only say 3 or 4 of them did I find a statistically significant benefit of my drug over the other drug. So then I could just say, okay, well, I'll just publish those 3,
Hmm.
not tell anyone about the other 97. And because of the way statistics work, you would expect 20%, sorry, you would expect 5%, 1 in 20 of those outcomes to find a significant result as a false positive result.
Yeah.
Again, we're back to dichotomizing, which I'm not a big fan of, but if you go into that framework, you would expect that. And so pre registration prevents you from doing that. It says, I have to be transparent in what I hypothesized, I have to tell you what it is I'm going to do. And then it's not that I can't deviate from that, I can, but then any deviation that I make, I have to A, tell you about, and B, people then can say, okay, it's interesting that you found this, but you didn't hypothesize it ahead of time. So it becomes more exploratory. We'd have to
Mhm.
confirm that. We wouldn't just say, oh, this is the answer. I mean, we never just say this is the answer based on one study, but you get the idea. For observational studies, it's more difficult. For one, it's just difficult from a practical standpoint. How would you ever actually set up a system? Because with a trial, we know the time at which things have to get registered. It's before the first person is randomized, and
Yeah.
we can verify that with data. With observational studies, the data often already exist. We're often using data sets that are secondary data sets. And so, how would we ever know if somebody did an analysis, found there was going to be, a significant result, then wrote the protocol and registered it, and then said, now I'll do my study and I find that, it's true. Now, I like to think that most people are actually pretty honest and transparent. And so I do think there is some benefit to the idea of at least just being transparent in what you thought ahead of time. So I generally am supportive of the idea, but I think in the world of observational research, it's not going to be easy, and even if only 1 in 1,000 people use it to game the system, those people are always going to be at an advantage in terms of publications and things like that than everybody else, and that's going to sort of ruin the system a bit.
Yeah. So then where and you are an editor for the American Journal of Epidemiology. What do you think are then the most persistent mistakes that we make? Not thinking about a specific method we make or limitations to the current methods that we have when you have paper submissions that challenge what we can infer from our epidemiological papers.
So I guess I would say two, and one is kind of a cop out that you're not going to like.
Sure.
But the first is the issue that we discussed, which is having a clear study question.
Yeah.
So I said in the beginning, you asked what is epidemiology, and I said, we're trying to describe where disease is occurring. We're trying to predict where it's going to occur or who it's going to occur, and then find the causes. Those are three different distinct
Mm.
tasks. One is description. I want to just describe the world as it is so that, I think about COVID, we wanted to know where was COVID occurring so that we could, intervene in those places. Um, Prediction is the second task. We want to predict who's going to develop the disease. I don't care whether the information that I could use to predict disease are necessarily the causes of disease. So, for example, I could, ask people, are you carrying a pack of matches right now?
Mm.
And anybody who is carrying a pack of matches, I would say, okay, you are more likely than the people who are not carrying a pack of matches to develop lung cancer over the next 30 years.
Mm.
Carrying the matches is not the cause of their lung cancer. It's that matches are associated with smoking. But I can use that for,
People now use lighters, right?
I've heard of them, but, in my 19th century brain,
Yes.
those don't exist yet. 20th century, whatever it is, I don't know. But I can use that to predict, and therefore I could say, okay, I have a smoking cessation program, and I'm just going to look for people carrying matches and
Yeah.
target it towards them, and I could have some benefit. Then the third is causation, right? And for that, well, if I were to identify that carrying matches is a cause of lung cancer, and I said, okay, we're going to ban matches, then I wouldn't do anything for improving lung cancer rates because it's smoking. And as you say, people could just light their cigarettes with lighters. So I need to actually use different methods for each of those three tasks.
Hmm.
And it's amazing how often I get a paper and I don't know what the goal was. Was it descriptive, predictive, or causal? So the first thing is just getting people to frame their questions clearly, and then, as we talked about, making sure that that is what they're actually answering with the data that they are using and the design that they are using. Then the second thing is just a general catch all, which is to say, it isn't that there is one thing that I could point to say goes wrong more than others. There are all kinds of things that can go wrong. What I think the biggest problem is we aren't as transparent as we should be about what those mistakes are.
Hmm.
Sometimes because we just don't realize it's a problem, but sometimes because we realize it's a problem, we don't realize how big of a problem it is. And once we're transparent about them, then actually using methods that we have that we don't require people to use, but we have to quantify the impact of those sources of bias. If we do that, we're always going to be less certain in our results. So there's no incentive for me to do it unless somebody makes me, because my results are always going to appear less certain than yours where you don't use these methods. But I think we would get out of a lot of the situations where we think we found some important relationship when actually we didn't. It's just that we never quantified the impact of the sources of bias.
And what's the cop out?
That's the cop out, is that I didn't give you a
No,
specific problem. I just gave
I
you a
actually thought
general
that
one.
was very, yeah, I do think but that is a helpful way to think because it's similar to what you said earlier. There is no specific method that we can ascribe to anyone. It's just whatever method you use, you need to make sure that we understand the limitations of that method. And I sometimes wonder if the limitations section in our papers is helpful because some of the cop out we do as authors, at least I do, is just I know the limitations of the methods I have, and the one way I can get away with it is just writing it up in the limitation section and saying, "Oops, there's nothing we can do about this." So sometimes I wonder about the benefits versus the some of the harm we get from having a limitation section. I still like it.
Yeah, and
Yeah.
I'll just say this, and I'm
Yeah.
alone apparently in this
Yeah.
feeling, but I think we should get rid of discussion sections completely
Oh wow.
from papers. Have I not said this to you before?
No, that's interesting.
Oh yeah, I don't like discussion sections because what is a discussion section of a research paper? It's a typically the first paragraph basically just states the conclusions. Then you have a whole sort of set of paragraphs that are designed to put the research in context of other studies,
Yeah.
and then you get the limitations, and then you get a restatement of the conclusions. Notice that you've stated the conclusions before you've told me the limitations, as
Yeah.
if you just ignored all of the limitations in drawing your conclusions. And second, all of that context that you give me, while I'm not saying it's bad, but it's generally I pick a set of studies that I am most familiar with or that correspond best to what I found, rather than doing like the full literature review, because that would take too long. And therefore, I'm just incentivized to write a discussion section. And again, I'm not saying people do this intentionally. I'm just
Yeah.
saying the incentives are not aligned. I'm incentivized to sort of convince you that my paper is a really good paper. So I don't need to read that. I do like the limitation section. I would make that the last section of the results section. But
Interesting.
even there,
Yeah.
I'd much rather than you tell me the limitations, you actually quantify the limitations. But you said, you use that as your sort of catch all. We all do.
Yeah.
And the reason for that is nobody requires us to do more.
Hmm.
So I always say, like, if you want to do a study of whether or not alcohol causes lung cancer, you could never do that study and not collect information on and adjust for smoking, because everybody knows smoking is a huge cause of lung cancer. But every other source of bias, selection bias, misclassification, we also have methods to deal with those biases. And as a field, we've agreed, you don't really have to do that. You can just put it into the discussion section in the limitations, and we'll let you get away with it. You get away with it until
Hmm.
the field changes to requiring quantification of that. There's no you are only going to be penalized for doing more, right? Because you're always going to have less certain results. So we really have to change the field.
Okay, so many questions there, and I know we don't have a lot of time, but the first one is I want to go back to what you said about fixing the field and how we actually get people to change what they do in their papers. But I was actually going to ask you if we move the limitation section up, would you be more happy with the discussion section? It seems like maybe, but
Not
that,
much.
yeah, but
I would like to see the conclusions come after the limitations and
okay,
account for the limitations.
okay. But then the question becomes, I wonder if there's a tension between what we said very early in the episode today that we you need experts to interpret the results. So where would an expert interpret the results of a paper if not in their discussion section for a layperson?
Okay, so that's an interesting question. Um, for a layperson, I'm not convinced
Hmm.
that many people are actually going to the actual papers, reading the full paper, and then reading the discussion section. So
Okay.
to me, a discussion section is geared towards other researchers, and therefore I don't think you need it. But you do make a really good point, which is we do need lay summaries of research.
Interesting.
And one thing, it's worth noting that journals have actually gotten better at that. Many more journals now require you to write that.
Yeah.
I'm not sure, and I don't know if anybody has actually done much research on this, but I'm not sure how good those lay summaries are at communicating the findings uh, transparently in light of all the limitations that are there.
Hmm.
And it actually would be really interesting to know that. And I say that again in part not because I think people are necessarily trying to spin their research, but I think that has the added complication of we are trained to write for other researchers. We're not trained to write for the general public, and that's a failing on our part.
Yeah.
But it is something that we're not trained to do, and yet we're asked to do more and more.
And I also wonder if it's one of those things that it comes as an afterthought. I'm thinking if I have to submit my paper, I look at multiple journals. One journal requires it compared to four. Maybe I go through three of the four, and then the fourth one I have to write something for a lay audience, and I just do it very quickly because it's not required across journals.
I would agree, and I
Yeah.
suspect that AI is going to be
Yeah.
writing more and
Yeah.
more of those.
Yeah.
I think people might say to themselves, "Well, it wouldn't be ethical for me to have AI write the paper,
Yeah.
but it's perfectly reasonable for me to have AI write the summary." And I, I guess I actually don't see a theoretical problem with that, but the
No.
what actually comes out might not be anything that is an accurate interpretation.
And so I think you just mentioned maybe quickly thinking about how do we change the field here. You said until we require people to think more about the other limitations in the field, it will be very hard to think about those limitations. Who do you think would be a good entity to try to implement this type of work? Would it be journals in our training in schools? Who else would require this? Funders?
It's got to start with journals and funders. So funders need to require this as part of their requirements for funding a grant, is to say that you're going to do this. But that only goes so far, because you can sort of do it for the grant, let's say, to meet your obligations to the funder, but then not necessarily publish that additional set of transparent results. So journals are going to have to require it, and ultimately, I think it's actually going to need to start with journal editors. They're going to need to be the ones to say, hey, look, if you want to publish your paper in our journal, you will need to not just discuss these limitations, but quantify, so that we have a realistic picture of the impact of these sources of bias and the uncertainty that goes along with them. There is a challenge there, though, because there is a first mover problem, that if you are the one journal that requires it and no other journal does, unless you are the journal that is, the top of the field, people are always going to want to look somewhere else rather than doing the extra work. So until it becomes more widespread that journals in general require this, you're definitely going to see some people steer away from journals that would require it. So we really need a movement as a field, more than just one or two journals to start the process.
So then thinking, I think we talked a bit earlier about the communicating uncertainty. If we do all of this, my assumption is we're going to be just more uncertain in what we say in our papers.
Yeah.
You did actually work on a paper or publish a paper a few years ago, I think 2022, that tried to evaluate the type of language epidemiologists use in their research. I guess not epidemiologists, but papers that concern some sort of epidemiology of some sort of a health condition. And can you tell us a bit more about what you found in that paper, but also why did you think that was a helpful paper to actually conduct?
So this was you're talking about Noah Haber's paper on
Yeah.
causal language. So I would say that's actually a bit less about uncertainty.
Hmm.
It's more about being clear in the language that describes the goals of a particular study, and it's
Interesting.
for exactly the reasons that we were talking about in the a few minutes ago, about the number of times when I get papers and I can't tell what the objective of the paper actually is, because the language isn't clear. So for a long time, journals have had not all journals, but many journals have had a restriction that says, if you are not doing a randomized trial, you cannot use causal language. So you cannot say that my objective is to estimate the effect of X on Y unless you do a trial. And there are some okay reasons for why that was started, but mostly I think that was just people believing that trials assess causation and observational studies don't, and that's something I fundamentally disagree with. You
Mm.
can have trials that don't actually get to causation, and you can have observational studies that do. It's really about the quality of the study. But regardless, I always need to know, not in your conclusions, whether or not you reached causation. Right there, you might say, okay, we didn't quite get there, and these are the reasons. So I won't use the word causation. But I need to know, was your aim causation? Because as we said, the methods that you use flow from the aims. And so I can't evaluate your paper unless I know. And so in that paper, we went through and reviewed studies throughout the literature to say, what kinds of words are they using that describe the aims of their studies, and can we figure out from those words whether or not they were looking at causation, description, or prediction. And we have built a whole vocabulary of words to make it difficult for anybody to know. So we say association, or we say risk factor, or we say, increases the risk of, or all of these things that nobody knows precisely what they mean, when we have these three words that could make it all very clear: description, prediction, causation. But because journals have prevented
But
people for a
do
long
you
time
think,
from using those words, it's hard
yeah,
to know.
do you think there is a continuum between maybe description and causation that leads people also sometimes to not know what they are getting at? Or you don't think that's the case? You think just people, we conflate what we're saying because of the restrictions from journals?
So I do think it's fair to say that there is sort of, you can think of a continuum, but they are ultimately, when we're doing research on them, I can't think of an example where your objective wouldn't be one of those distinct features. Even
Mm,
if you're doing both, you'd be doing them separately. And that's why I say that. So I said, remember the example that I gave you of carrying a pack of matches.
yeah.
Um, Instead, I could have, instead of looking at, carrying a pack of matches, I could say, do you smoke? Well, there, ultimately, we know that that is the cause. But let's say I wasn't comfortable saying that was a cause, but I could still use that for prediction. So anything that is causal is likely to also be predictive of an outcome. So there is a continuum in that causal things go in my predictive model, in addition to non causal things can go in my predictive model. But that's different from saying, what is my aim? And the reason why it matters is, if my goal is causation, then everything else that I put into a model to try and figure out the answer is just noise, right? It's just, I'm saying, I want to know the effect of smoking on lung cancer. I'm going to put 10 other things in my regression model, but that's just to say I want to create balance on those other things. There's no causal meaning to any of those other things. If my aim is prediction, then I want to throw in anything I possibly can that improves my ability to predict who's going to get the outcome. And then I can scale it back if I want to make it more, user friendly. But ultimately, my goal is just to get better and better prediction. And I don't care if any of those things is actually causal. I just want to know, can I figure out who's going to get the outcome? If my goal is description, then I don't want to adjust for anything. I want to describe the world as it actually is. And therefore, as I say, the methods flow from the aim. So until I can figure out what your aim is, I can't tell you if I think you had a design and analysis plan that makes sense.
That makes sense, because I was thinking more. I wonder if people think about it that way compared to, and I was trying to think why I think of it. Maybe it stems from people being uncertain about what they want to do versus not being clear, maybe in their own heads. Well, I guess it's the same thing, being uncertain and not being clear. But I guess I thought of it as, I'm not sure how to write this because maybe I didn't get enough training to distinguish between the three areas. And maybe if I just make it as vague as possible, that lets me get away with not having to quantify my certainty of how good my results are. So in my head, I was thinking a lot of people I talk to think any study that has a causal design or maybe an RCT, that result is certain, I'll take it. Versus anything that is more observational studies, which I don't necessarily agree with. As you said, a lot of RCTs can have randomized controlled trials, might have some limitations as well. But I think that makes sense, just thinking about the framing of, are we thinking about description, prediction, and causality, which is what we get taught in intro epi, but I'm not sure we go back to again
We
later.
we rarely, if ever, go back to it. Yeah, I so to me, this is it's partly a training problem,
Yeah.
that it's only more recently that we've actually started to be clear in making the distinction between those three different objectives of epidemiology. But even then, we still spend almost all the rest of our time talking about causation. And we don't really teach people how to do good predictive models or good descriptive studies. Um, but I think it's also just a historical quirk of the field that people are also taught never to use the word causation, because no journal will ever publish your observational study if you do, but that just leads us to lack of clarity. Or sorry, the other thing is, I think there are times when people, their aim is causation, but they know they have some problems that prevent them from truly getting there. And
Mm,
therefore, the aim was causation, but they don't want to say causation. Well, just because you were trying to get at causation and you didn't, doesn't make your study suddenly predictive or descriptive. It just means you did a causal study and you
flawed.
didn't get all the way there, which is a very common thing. You still need to know what the aim was. And the aim is causation. And let's just be transparent about that.
Yeah. And it makes me also wonder, just thinking very quickly here, thinking in the future, I think conceptually we all acknowledge that science is just, it's a process that builds, like the knowledge generation, it builds on everything that exists before what you have. So conceptually acknowledge that. But then when it comes to our papers, if it's flawed in any way, but we try our best, it still feels like we can't really say we aim for causation. We didn't get there, but we still think it's helpful to put it out there for other people to build on it. Okay, so I know you have, I've taken up way more of your time than we should, but I do have 4 rapid fire questions
Okay.
that I want you to think about very quickly.
Are these like yes, no questions, or do I get to expound on things?
They're not yes, no, actually. They're more
Oh,
of a few words. So
okay.
I've never known you to be a man of few words. They're all wise words, but usually take more than one sentence for you to explain what you needs to be done. So,
That's the first time you've ever said I had wise words.
let's- so the first one is, what is the most overrated epidemiological method?
The most overrated epidemiological method? Oh my gosh. What a question. Um, the most overrated. Well, I guess I would say, um, but I have to clarify what I mean, would be adjustment for confounders. And
Hmm.
overrated, not because it isn't important, it's essential. It's that we spend so much time teaching it, to the detriment of teaching people how to deal with other sources of bias, that I think it just becomes overrated by virtue of, like I always say, like if you think of confounding selection bias and as information bias, mismeasurement of variables, as 3 children in a family, confounding is the classic first child, like has to have all the attention from the parents and the other two kind of get ignored. Uh, it's overrated simply because it isn't the only bias out there, but it's the only one that we force people to actually address head on.
Yeah, I love that answer. It was not
Not
rapid
rapid
fire.
fire.
But, it's an epidemiologist answer. It
Yes, it is.
basically
It
depends.
depends.
Yes. So what is one book every epidemiologist or aspiring epidemiologist should read?
So I don't know about every epidemiologist, but sort of everyone who has gotten past their at least their first epimethods class would be Modern Epidemiology. It is a really dense and difficult book. I'm not trying to suggest in any way that it's an easy book, but it's got it is the book that has cataloged all the way over 4 editions, all the ways in which we have historically made some big mistakes in methods in the field, and then how we have actually improved things.
What's an epidemiology, maybe slash broader public health myth that you wish would disappear?
Okay, so we already discussed it, which is the idea that the aim of an epidemiologist is to figure out whether or not A causes B.
Hmm.
It's not. The goal of an epidemiologist is to figure out what is the magnitude of the effect of A on B.
What one change would have the best or the biggest impact on epidemiology today that you would advocate for?
Getting rid of journals, in particular, getting rid of journals' obsession with publishing significant findings, even when they say that they aren't. But I think we could do probably an even bigger service if we got rid of journals altogether, because uh, journals act as gatekeepers, but they also have this weird setup where I get money from the government to do the study. I then take a big chunk of that money. I pay a journal to publish that research. They take the work that I have done, funded by the government, and they get all the money to publish the thing. And then they turn around and sell it and make more money. It's a very strange setup. And in the world of the internet, I don't see why we can't set up our own systems to publish research that would be just as useful.
Wow. Okay, so that's a big answer for rapid fire, but I have to follow up just quickly. So
Okay.
you're saying we should abolish journals, which I don't know if conceptually if I
I don't
agree.
mean abolish, but then we
But
just stop publishing in them
yeah,
and form our own, you know,
so in an
uh,
ideal world, they would perish once we do this.
journals would perish. No, sorry, I don't know that journals themselves would perish. I think we would, or maybe they would, but we would replace them with journals that are run with incentives that actually align with publishing everything and publishing. When I say publishing everything, I mean publishing uh, all the non-null findings that are also informative. So there are you can have null findings that don't tell you anything, but a nice precise null finding is really important. Um,
Hmm.
and then so we could get rid of a lot of those problems if the incentives were not profit.
So I do think there is a few things here. I think there is a postdoc or a doctoral student, I can't remember, at Columbia, who's an economist, who wrote something that is very interesting about this, thinking at least from an economic journal perspective. We'll put it in the show note. He's also making a similar argument. Again, I don't know if I conceptually disagree. I think journals have the highest profit margin after pharmaceutical companies, if I'm not mistaken. At least Elsevier. Again, I
A
could be
huge
wrong.
profit margin.
But then what do you do with peer review? Or do you don't think peer review adds to the process?
No, I actually do. So peer review is a flawed process, but I think it's better than the only alternative that I know of, which is to just let everybody publish everything online and let the marketplace sort it out because nobody has the time or energy to really actively review all these papers. So I do think you want some peer review process, as flawed as it is. I just think we want to hand that process over to a scientific body that is not profit based.
Hmm.
That is, is I don't know who would fund it, but it would take a lot less. Um, it wouldn't take massive amounts of funding to set them up. It doesn't take nothing. It absolutely does. And I don't mean to say, by the way, that journals provide no services whatsoever. They do provide some. I'm just not sure they provide services to the level of what we are charged for them.
So our final question is usually, what is something that you think needs to be more complicated? But I think your answer would be epidemiology. So my final question for you would be: if you were given a blank state today, you were assigned as the king of epidemiology, and you have to decide for the next decade that we need to change the field for the better. What are the key choices that you would implement to make sure that we actually have a better field 10 years from now?
It's an interesting question. I don't know that I could give you like we would do A, B, and C, but so the field of randomized trials went through this process where they came up with a set of guidelines called the consort guidelines that are
Mm.
meant to describe how you report your trials, and because they're required for reporting in journals, people generally follow them in their design process. There was a similar process that was done for observational studies called the strobe guidelines, and those are out there, and they're very useful, but people generally don't follow them, and journals don't generally require them. So I think I would sort of put a little bit of energy over the next few years into rethinking aspects of the stroke guidelines that we want to emphasize, particularly with these newer methodologies, and people are doing this. But then think about how we ensure that people get training in the things that we want them to do as part of good research practices, and how we ensure that whatever entity is going to publish that work going forward requires those, as part of the process. And by the way, I think part of the reason why people don't follow the strobe guidelines is because it's difficult, right? With trials, there's like 20 things you need to do, and they come up in almost every trial. Observational studies are very unique, and so you really have to like think through every possible situation. But again, AI can now do that for us, right? We can have AI, you know, say, "Oh, has my paper met all the things that I need to do for these reporting guidelines? If not, point to me where, and then I'll work on those." So, I think we have some tools. Much as I fear what AI is going to do to us in the future, let's at least take advantage of the things that I think it'd be able to do well for us.
I think a few journals like the Lancet, when I have to submit, they say you have to submit this to checklist, which is helpful because then you go back to your paper. Maybe hopefully you can do it before you have the paper written out, but then you say, have you actually met everything that I need to do? Matt Fox, that was really helpful. Thank you so much for joining us today.
Great to be here. Thank you for having me.
This podcast was edited by Zach Leonaris and Catalina Melendez Contreras. It is supported by the School of Public Health and Frick Initiative at Washington University in St. Louis. You can access this and other episodes wherever you get your podcast, or you can watch it on video on YouTube. Thank you for watching.